Welcome to the M38e mobile computing workstation from Capsa Healthcare. In the next few minutes, we'll introduce you to the innovative features that will help you save time, increase efficiency, and simplify clinical documentation in your demanding healthcare environment. Powering on your M38e is as simple as pushing a button on the keypad. The battery gauge illustrates remaining battery life to help minimize downtime. We recommend that you plug your card in whenever possible, so it is always ready and available for use. The M38e cart comes standard with a 15.5-inch range of height adjustment. Your workstation offers a simple push-button height adjustment that allows you to raise and lower the work surface to a personal comfort level for sitting and standing positions. The keyboard tray slides out and is adjustable for maximum ergonomic comfort, with convenient mouse surfaces on the left and right side. When standing, the keyboard can be adjusted for a negative tilt to provide better ergonomics. When working in a seated position, the keyboard can be tilted to a comfortable typing angle. The mouse surface can be pulled out for use and stowed when not in use. An integrated mouse holder keeps the mouse close at hand. Use the expandable work surface when more workspace is needed. Your cart is available with a work surface light and keyboard light to reduce visual strain when working in patient rooms or dimly lit hallways at night. The M38e monitor mount offers a range of adjustability. The monitor pivots 180 degrees from side to side, and the monitor height is adjustable over a range of 5 inches, so the monitor can be set to a comfortable reading level. The M38e is equipped with 4 5-inch casters. One front caster includes a gray locking lever that can be locked and unlocked with your foot. With the casters unlocked and moving independently, the cart can be moved wherever needed while working in a patient room. To keep the cart stationary, simply press down the gray lever in front to lock it in place. Your cart also comes standard with a directional caster, located in the front of the cart with a green lever. To engage the directional caster, point the cart and wheels straight and lock the directional caster by pushing down on the green lever. When the directional caster is engaged, it helps guide the cart, making it easier to push down hallways and around tight corners. When maneuvering the cart in a darkened room, ground lighting illuminates your path without waking the patient. The M38e's smaller profile glides easily through the care environment. As best practice, before pushing the cart, raise or lower the work surface to waist height and pivot the monitor to the side to provide a clear sight line. Engage the directional caster by pushing down on the green lever and then position your hands on the 2 contoured front handles. It is recommended that you keep both hands on the cart when navigating during your shift. These steps help ensure the most ergonomic handling, minimize shoulder and back strain, and help you maneuver the cart easily. If your cart is equipped with storage, you may need to enter an assigned PIN code to unlock the drawers. The cart may also be programmed to relock automatically within a specified period of time, or can be relocked with the push of a button. The M38e is designed for easy cleaning, with raised edges to retain spills. Wipe the cart down with your standard approved cleaning solutions or wipes. We also recommend you follow your facility's infection control protocol. Our job is to help you do yours. The M38e is reliable, easy to use, and helps you meet the demands of 24/7 care seamlessly and efficiently. Contact Capsa Healthcare for additional product information, or if we can assist in optimizing the M38e mobile computing workstation to meet your needs.